We will be starting the live webinar in another 2 minutes. Good evening, everyone. Myself Chandan, and I am a first year student of IIHMR Bangalore. Today, we are gathered here to conduct a live webinar on effective stress management during the COVID-19 pandemic. I have got this golden opportunity to pass my cheerful welcome to all the participants and the guest speakers on today at one place. Arun sir, please change the slide, sir. IHMR Bangalore was back started in 2004 and after that it is making its presence strongly in the healthcare sector. Our management courses are providing results on an yearly basis. It is ranked as the top hospital management college by Higher Education Review magazine 2017 and 18. It has also received National Award for Excellence in Education in the category Educational Institute with Best Academic and Industry Interface by World Education Congress, Mumbai in 2020. And our institute is also accredited as a consultancy organization for NABH by National Accreditation Board for Education and Training. Next slide, sir. At IHMR Bangalore, we are motivated to provide research, consultancy, academics, learning and development, under which we have very strong expertise in research as well as the academics and consultancy and learning and development. Next slide, please. I would like to welcome on board our Associate Professor, Dr. Krishna Kumar sir. He's a MBBS graduate with rich experience of more than 16 years in academics and home healthcare. He started his career as an epidemiologist at Singapore Hospital, and he is also currently a life member of Indian Medical Association. He has also been awarded with Best Quality Improvement Project of the Year in 2012 and for the project of quality improvement in reducing noise in the NICU, and he is currently uh, an associate professor at IHMR Bangalore. Next slide, sir. I would like to welcome our guest speaker of the day, Dr. Bharati Rajendran, who has been constantly marking her presence in government healthcare sector, and her experience is as a clinical psychiatrist for 3 years has provided valuable insights in health awareness campaign, infection control committee, pulse polio program, and she has been also awarded for her research paper in 2020. And her interest strongly lies in personality disorders, several mental illness management, substance use disorders, and she has completed multiple workshops in stress management and productive enhancement program. Next slide, please. I would like to welcome our guest speaker, Dr. Raghunath Parakal. He is former Prime Minister and Chief Minister awardee. He has been featured in Times Square, New York, USA, and he's also a world record creator with EduClouds. He has got awarded as 158 national, international, and local awards, out of which 41 are international awards. And he has a very vast experience in working in different hospitals in Palana Hospital, Co-op Hospital, Wellcare Hospital, Rajiv Gandhi Hospital, Nandavanam Hospital, and he has also been an expert in global career counseling as well as a certified counselor by University of California. Now I would like Dr. Krishna Kumar sir to take over to take you through the rest of the live webinar. Thank you.
Thank you. On behalf of IIHMR Bangalore, I once again welcome all the participants and our guest faculty, and good evening, everyone. This COVID pandemic has a major effect on our lives. Many of us are facing the challenges that can be stressful, overwhelming, and cause strong emotions in adults and children and elderly people. Public health actions such as social distancing are necessary to reduce the spread of COVID-19, but they can make us feel isolated and lonely and can increase the stress and anxiety in every human being. Fear, worry, and stress are normal responses to the perceived or real threats. And at times, when we are faced with the uncertainty or unknown, added to the fear and contracting the virus in the pandemic, such as COVID-19, or the significant changes to our daily lives and our movements are restricted in the support of efforts to contain and slow down the spread of the virus. Faced with new realities of the working from home, temporary unemployment, homeschooling of the children, COVID affected people in the quarantine at home or at hospital or in our own family, others' family, friends, neighbors, and colleagues. Now it is important that we need to look after our mental health also and managing our stress in day-to-day life. IIHMR Bangalore, with eminent health professionals from the industry, is conducting the webinar during the COVID-19 pandemic for health workers, managers of the healthcare facilities, and prospective management students and pupil isolation and members of the public to look after our mental health and effective stress management. With that note, I would like to introduce Dr. Bharati Rajendran to take forward the session. Thank you.
Thank you, sir. Am I audible?
Yes.
Let us share my presentation. Is my slides are visible, sir?
Yes, visible.
Visible.
Yeah. Good evening, everyone. First of all, I thank all the organizers of this institute as well as other members for arranging this topic, which is essential for this current scenario. I request all the participants as well as their families as well as other public to follow all the rules and regulations which was implicated to contain the infection as well as the spread of infection of COVID. And actually the current scenario is like watching a movie and being in a movie, a thriller movie, where we don't know about the climax, but everyone are playing a role of hero with fighting against an invisible villain, COVID. Today, I'm going to just give a brief outline on the basis of stress, its concepts, and what are all the impacts of COVID and its mitigation measures towards us, and how it affects our mental wellness. Along with that, what are the healthy way of coping this stress, especially this quarantine as well as lockdown measures, as well as grieving process. Actually, the stress is defined as a physiological and a psychological and a behavioral response by an individual when there is a disturbance in the equilibrium, where there is demand is placed much more, when their abilities to meet those demands were lesser over a period of time. But this stress leads to an ill health. This is like a wear and tear of our mind as well as body's experience when we try to cope up with the even anything which affects us as a homeostasis, that will preceded as that will thought as a stress. So if it was an unknown fear where we don't know about that etiology or what is going to happen further, then we develop anxiety. This is the natural body response to the stress. As we are evolved from animals, each animal, when it was exposed to a predator, it has to express some response. Either it's a fight or a flight. So similar way, we also express the same kind of response, either in an anxiety or in a accepting that and trying to cope up with that. And depression is viewed as a state of disinterest in daily activities along with low mood and low energy level. So there are lots of myths about the stress. They think that all stress is bad, but actually it's a misnomer. Stress means there are two types. One is eustress and a distress. Eustress is the one which helps us to be more productive, like accepting a challenge or doing a better job in your work and making yourself competent in something. That is eustress, where you will be more productive. But distress is the one which actually we have to deal today, in which whatever in life, better feeling, everything, competency is a component of eustress. And many people thought that less stress, there will be a better life. It's not. Optimum level of stress is necessary to be a productive life. And goal of stress management, many people thought that we should be in a zero stress. And a good life means there is no stressors at all, but it's not at all possible in any kind of environment, not only for us, even for any living beings. And a person can always successfully adapt to a difficult circumstances if they tries hard. No, if the many people need some assistance to go through all these stresses, sometimes need a professional help also. And many of us thought that physical exercise will drain our energy, thereby the person will be more stressed. But the physical exercise will help you to regulate your stress hormones and elevate the neurotransmitters like serotonin and other endorphins, which helps to and activates multiple areas in your brain to overcome the stress. And many thought that meditation is a religious oriented, but actually the initial phases of meditation where we make that meditation as a process for being aware about ourselves, that is more of mindfulness will be a part of a meditation. And we thought that stress affects only adults. It's quite wrong. Do you know when the stress has started? Actually, around 120 to 150 million of sperms are trying to capture one ovum, and each of us are evidence for a living evidence of a success of that stress, where we thought that stress is only affecting the adults, but children also equally get affected by the stress. But the way of behaving and response towards the stress is different from adults in children. So stress has to be addressed even in children as well as adolescents. And this is the stress performance curve, where you can able to see that optimum level of stress is helpful for a successful life. When it was exceeding the limit, then you will feel more exhausted, and finally you will go in for a breakdown, and then you will feel more burnout, where you need more professional help to overcome that. And this is the general adaptation syndrome, where initial phase is an alarm phase. For example, if a person was diagnosed as a COVID, then there will be initial alarm phase, and then they will go in for a arousal phase, and they will be little depressed, and then they will overcome that and went to a resistance phase. If it was not able to compete by the person, then he will go in for an exhaustion phase, where he needs assistance by professionals as well as others. So what is the impact of this COVID, especially in India? Actually, there are rising number of cases, as well as we know that there is a second wave, which was much more. We are getting more number of cases than in the first wave. Here, we need that we should be aware of this current COVID situation, and we should follow all the mitigation measures to prevent the spread. So this will also rise as a medico-socio-economic crisis, and our country is still struggling with to compete all these. It not only make a issue on the physical health, but it make a scar on the mental health because of its uncertainty. And it also gives threats towards the mental health, where there is more of systemic social inequalities, where there is the demographic differences between multiple states as well as multiple regions in related to the caste, age, ethnicity, because the first wave affects predominantly elder population, and the current wave affects even the children. And there is the economic instability, especially unemployment, and there is the income resources has reduced, and neighborhood issues, like if the person is going to get quarantined in the home, and the neighborhood people will feel that there is a stigma and they will avoid them. So all these, as well as the overcrowding. Even recently, I have seen in the news that a person, there is only one room in their family for being together. So he came to a nearby tree and stayed there in this tree for a quarantine, as he was a COVID positive. So those kind of issues, as well as the social and cultural, where there is a loss of social support. Previously, whatever in our culture, if someone is getting infected or someone health gets spoiled, if he was admitted in hospital, all the relatives and other family members will go and support. But the current situation, which made them not to have a contact, so this reduces more of social support, as well as and uncertainty, what is going to happen for me and what is going to happen for the family members if I was there in the hospital. So all those kind of issues were started threatening their livelihood. And there is increased exposure to the risk factors as well. So there is economic stresses are there, job insecurity is there, and social isolation was there, and there are multiple barriers to reach out the mental health treatment. Even a known case of mental illness patient is also having a difficulty to approach the hospital because of this COVID situation. So there are other even medical illness as well, diabetes as well as other hypertension, even all those physical health problems also went as an unnoticed issues. So this were creating a further exacerbation of the issues. And the measures, social distancing, isolation, and quarantine and lockdown, all those are arising an issue in the vulnerable population. And this economic slowdown, which increases further anxiety, mental illnesses, depression, more of suicidal tendencies, where they couldn't able to cope up with that, and trying to think the suicide is an only option to get away or escape from that issue. So, and or else going into an increased use of alcoholism. Alcohol, like even when a day where they were announcing the lockdown, there was huge amount of money was transacted for buying alcohol itself, and even drinking other substances like sanitizer instead of alcohol to overcome the withdrawal symptoms. All those, as well as eccentric behaviors, especially domestic violence, all those were increasing in rate. And insufficient resource allocation was there in the healthcare workers, because the rising cases as well as the fatality need much more hospital beds, and even many government hospitals were filled, where all the beds were filled, and many people are lying on the floor and even crying for having a bed, all those things. And the other thing was fear of infection. Even a person was following all the mitigation measures, even then they are still continue to have that fear of infection, whether they will have contracted some infection, and frequently checking about their physical symptoms, about their whether they can able to smell the thing, whether they can able to feel the taste, like that. And social media, which was flooded with all the messages, more of negative affirmations, make the people to be more fearful and having a more stigma towards the illness. So all these fears and worries all together stir up and form a chain of negative emotion as well as the cognitive response in associated with the COVID-19. And this had an adverse impact over the physical health and potent cause for current surge of mental health dysfunctions. It also, the reports and surveys showed there's 30% increase in the anxiety as well as the depressive disorder when comparing with the last year to the current 2021 of January. So this was predominantly due to COVID stress, as well as the vulnerable population, especially the women, as well as the adult age group who are all in a productive age group. Those also having more of anxiety, social dysfunction, as well as fearfulness in related to the uncertainty of the future. And 20% of population will going to have some mental disorder. This was a prediction given by the WHO currently according to the present situation. And even the Indian Psychiatric Society also, said that recent survey, there is 20% increase in number of cases in related to depression, suicides, as well as alcohol addicts due to corona outbreak. Even that Field COVID is an online survey which measures the psychological impact, that shows there is a 1/3 of the respondent are having some psychological impact. And predominantly those age 18 to 24 years, and those having higher rate of anxiety as well as depressive disorder, because they are seems to be that is the age group where they have to be more social and they want to be get their identity and being a productive person. But that period was being locked more than for 1.5 years. There is no colleges, they have to attend online classes, and they don't know what is going on there and how the exams are going to be conducted. So all those things make them more anxious and more depressed. And another study also reported that is mild stress was persistently there among both males as well as the females with moderate anxiety and depression. Those vulnerable population are females, younger age group, those who are all having fear of losing a job, and substance users like alcohol and smoking and other substances or other illicit drugs, and predominantly physically inactive throughout the day and lack of routine life where there is no schedule in the lifestyle, waking at a erratic pattern, eating in erratic time, going to bed in the late nights, and increased exposure to the electronic gadgets, not only for the adults, even for the kids. Because many of the parents doesn't know how to manage them, so they will give more of electronic gadgets to them. And there is a significant decrease in the resources, especially the mental health professionals. Because for 10,000 population, there is less than one person is there to provide mental health services, even if they are trying to contact them. And what are all the physical symptoms because of stress? So we know that there is for example, if you wake up in the middle of a night, in the darkness, you're just seeing something lying on the floor, how you will feel? You will have more of increased heart rate, you will feel more fearful, you will think that whether this could be a something snake or something else. But when you came to know that it's just a threat, every symptoms like all your palpitations, sweating, everything goes off. So nothing is changed, either the thread or the presence of something or the darkness, nothing was changed. Only our thinking changes all our physical symptoms. So here also the stress predominantly produces multiple physical symptoms. That's why we also call psychosomatic disorders, where predominantly having GI disturbances, irritable bowel syndrome, acidity, and ulcer disorders, all those are considered as a psychosomatic disorders. So in related to this COVID stress, predominantly they will feel like something happened to their body. They will feel more tired and their muscles are becoming tight and their stomach was getting upset. They feel there is decreased breath for them and having difficulty to breathe well. And they feel that something was obstructing in their throat and not having proper appetite, multiple body pain, or else worsening of the previous myalgia or other headache. Frequency of headache can increase, as well as the infections like skin infections and other bowel symptoms can worsen, even if the patient, even they were no case of asthma or like that. Other emotional as well as the behavioral symptoms are usually they couldn't able to focus on what they are doing and getting more anger towards others and can't be there in a home or in a position for a longer time, difficulty in concentrating to do any work and having a difficulty to get into sleep, and always having more of negative thinking, uncertainty about the future, more arguments with the family members, always feel very tired and often getting crying towards that or worrying too much. Sometimes they may feel more sad as well as the guilty. And there may be change in their appetite as well. Some people will have increased appetite and they will eat predominantly more on fatty diet or carbohydrate foods. And sometimes they will avoid taking food and lost their weight as well. And other symptoms, even for anxiety, there will be more of physical symptoms where they will feel sudden increase in the heart rate, headache, or worsening in the breathing, and procrastinating, and more of worrying, and difficulty in sleep, and other worsening of their appetite as well as stomach issues. In anxiety, it will come and go suddenly without their knowledge, and suddenly they will feel all the physical symptoms as a predominant one. And most often they will think that was preceded by some thinking which they don't know. It was an unrecognized fear was there that could operate all these physical symptoms. So these stress can lead to multiple disorders. The adjustment disorder is the one where we couldn't able to adjust well towards a hurtful situation or a stressor. And it can produce an anxiety disorder and depression, where they will feel more decreased self-esteem. They feel that they couldn't able to overcome all the issues, and they will feel more guilt or sad and not able to concentrate, not able to enjoy their life. Even they may think of more of suicide, as well as all the past events or worrying about the future events, all those things. And the post-traumatic stress disorder, predominantly where when the person was diagnosed sudden as a COVID positive, or a traumatic event. So that can come as a flashbacks even when they are out of that illness and getting better, and even after reaching the home, those kind of flashbacks suddenly coming and going and disturbing their routine. Those were called as post-traumatic stress disorder. And other substance use disorders, where usually the people may think that I'm not an addict, I'm not at all taking the alcohol routine basis, as I am feeling more boredom, as well as I am feeling more frustrated, so I am taking all these things. But the quantity as well as that rate of taking the drugs as well as other substances were increasing without their knowledge. But that itself a cause for going for a substance use disorder, a dependent state. And it's OCD is an obsessive compulsive disorder where the person will think that they are contacted with an infection. So they will think that they have a fear that the infection was still there and going for repeated hand washing. Even now for COVID also, we advise the persons to wash their hands routinely whenever they are going out or touching something. But they will have more significant distress towards that. Even after washing, they won't feel that it was completely clear. They will have doubt. So they will repeatedly washing their hands. And that was worsened even in this COVID situation. And thanatophobia, where there is a fear of dying, whether we will be dying. If we diagnosed as a positive COVID, then we are going to die. What could be happen? And those fear which disturbs their routine. And behavioral disturbances in children and sleep disturbances in as well as insomnias and other psychosomatic issues and eccentric behaviors and emotional outbursts. These are all related to the stress where they need to ask for a professional help. Now, how to cope with this stress as well as anxiety, and what are all the coping strategies we are going to discuss now. So first, I'm going to discuss about the strategies for grief. Grief is not only for losing a person or a loved one because of COVID. Even losing a job, losing a routine work, if they are asked to do some, that is either the neighborhood people would have diagnosed as a COVID. So all those kind of stress can be considered as a grief. So, and grief is a normal response due to loss. Either it's because of some traumatic event or a disaster, and this is a drastic change in the daily routines. That was happened recently for most of us. And their usual way of life was disturbed, and where they feeling more of instability in their routine work. So the grief is to be managed. And bereavement, it's a situation in a loss where that it manifests physiologically as well as the psychologically, even harmful to the health systems. And grief, it's a complex and emotional response. And it is like the physiological procedure which was happened during the recovery from the grief is mourning. And normal responses where there will be emotions. Initially, you will feel more sad, either anger or guilt or anxiety or loneliness. You will feel more helplessness. If you are diagnosed, if anyone diagnosed to be a positive, then they will feel more shock in related to that, and fatigue. And sometimes there will be no emotions and they will be very numb. All these were normal in a grief. And there may be some physical symptoms. There may be pain and discomfort and lack of energy. They will feel more weakened, and they will be very hypersensitivity towards the sound or some breathing difficulty as well. And they may also have some perceptual process and disturbances where they will be more confused, and they won't believe, even if they are diagnosed as COVID, they will think that no, it will be something else, and they will try to get some other opinion as well. So difficulty in understanding a sense of time, space, and illusions. And there will be behavioral disturbance as well. There will be sleep disturbances, appetite will be disturbed, and there will be ambivalent towards any activity. They may withdrawn, or sometimes dreams about those person who lost their life, either their father or mother or brother or relative, and avoiding those discussions with them related to that, and crying and visiting their places which reminds them, and keeping the objects. So all these responses are normal only in a grief. And this is the 5 phases which everyone has to undergo if they are exposed to a sudden grief. That is, initially they will be denying of that thing. If a person was diagnosed to be a COVID, they will have confused and they will be shocked and they will have a fear in related to that, and they will think that it's not a real positive. There may be something else. They are misdiagnosed themselves. This denial in the current situation worsens their seeking a healthcare or a seeking towards the healthcare professional. They may be in the home itself and trying to take some other medications, and suddenly they may go in for a gasping. At that time, they will rush to the hospital. So this denial, if they were persisting in the same stage, that will hazard their progress and getting better in their infection. And next stage is the anger, where there will be more anger towards either towards the family members or towards the society or towards the government or towards the other people, saying that they would have done better to avoid all these things. So they will be more frustrated and irritable. And this is the stage where they will be very angry towards the health professional as well. Because at that time, most of the healthcare persons, they will reach in a last stage like gasping and all. And if there is no bed, then they will be in the same anger and they will try to assault. So those kind of outbursts will be there in the second stage. And then they will going for a bargaining stage, where they will bargain either with the God or with the nature and trying to express their hostility and sometimes feel more helplessness. And they will think predominantly either to get away from this, either by committing suicide or avoiding all those things like that. Then they will go in for a depression. They will try to find out what is the meaning behind this, why it was happened to me, and what is this, how can I manage. All those things will be going up. Later, they may go in for an acceptance stage, where they will find out, okay, this is the situation, so how I am going to manage further, and what are all the options for me to get away from this, and how we can cope up with this. All those coping strategies will come and act in the acceptance stage. So for each stage, we need to be supported. So initially, there should be enough communication as well as information to pass over that initial two phases. And in the bargaining phase, need to be more emotionally supported. And then they need more of guidance and direction to cope up the stress. So what are the mediators for this grieving? So it depends upon the person who died or either who was infected, either it's a partner or a child or a parent, what kind of relationship with them. So that decides how the intensity of the grief will be there and how much it was ambivalent and what are the conflicts as well as the dependency. And how the person was died, either by the natural causes or sudden an accident or by suicide or because of this illness. And what are all the previous experiences which was happened by this similar death or loss, and depends upon the personality. So how he was able to deal with the problems previously, how about his self-esteem, self-efficacy, and how about their values, and how they were going to decide all these losses. All these things will be depend upon that personality itself. And other social factors like how much it was the environment was supporting. Previously, those religious rituals as well as other way of grieving, that was a healing process itself. So those was because of COVID, those were stopped as well as regulated. Even gathering of 5 or 10 people was allowed for a death itself. So that much getting socially isolated, that will also affect the grieving process. And other simultaneous stress factors, if that person was the only breadwinner, and what about the other issues in related to that, and if it was a parent, and how the child will going to grieve for this. So all these are affects the intensity as well as the duration of grieving process. There is no clear-cut way that this is the way to grieve. So each person grieving is individualized. Each person has their own way to grieve or to face all these processes. But only thing is, we should give enough time as well. And if it was exceeds more than a year or 6 months and it was persistent and along with there is depressive symptoms, then they have to approach for a professional help. That is, if there is no social support and there is no time for making them to grieve, because there is no economic support, they have to try for some other job and other related issues, and there is excessive reactions towards that. If there is any other physical or behavioral signs, and if it was a chronic grief, it was more than a year, or repeatedly thinking about the past events and not getting into a next stage, still they were blocked in some other stages itself. Before that acceptance itself, they are getting blocked, and there are significant depressive symptoms and significant disturbances in their functioning, day-to-day work as well as other activities, and predominantly having suicidal ideas, then they must consult a professional for overcome all this grieving process. So many of us will think that as the grieving process, it's a natural phenomenon. In what ways the therapy will going to help? But it was predominantly focusing to solve the stages which was not completed and helping the person to move on towards the next stage. So it helps the survivor to acknowledge the loss, that we have to accepting the reality that the person was lost, or the person was diagnosed as a COVID, or here it's a lockdown, we have to going to survive with this. So accepting that reality and helping the survivor to experience once their own emotions and how the life was adjusted towards that loss. So predominantly solution focused approach, where predominantly concentrating on problem solving skills as well as their issues in related to the problems, and searching for the meaning of loss. What is mean to be by the loss? And like that, that is in another way that we can be saying that celebrating that loss. Actually, the person may die, but the relationship never dies. Even they lost the father, the person was not there, but the father and son and daughter and a father, that relationship was persisting. And how we can able to imbibe that qualities of that person into our life. For example, if a person was, if that person was interested in pet animals, rearing or taking care of the pets or other animals, that will be as an alternate, just as a transitional object for the loss. And organization of emotions concerning to the loss and giving mourning time. And other general coping strategies during the stressful situations. So first I will say about all those maladaptive strategies which were wrong and which will worsen the stress and won't give any further improvement in your stress coping mechanisms, like yelling, trying not to think about it, just spending that time, just killing the time by watching TV or a mobile phone, and avoiding the people and discussing about all those issues, just feeling giving up and getting isolated from others, staying in the bed for a longer duration, just simply lying in the bed, or consuming alcohol, tobacco, or illicit drugs, taking sleeping pills on and off, and starting an arguments and blaming or criticizing others or self, even blaming themselves and feeling more guilt and feeling more tired. All those are maladaptive strategies to overcome the stress. So what are the useful way of coping this stress? We know something as if it was hooked, like if you are going to for fishing, you will have a hook. When the fish was caught in that, it couldn't able to escape. Likewise, like that, our thoughts as well as the feelings are like hook, which can pull us. So sometimes we will feel like want to play with the children and enjoy that moment. But whenever our thoughts and feelings, which was hooked us, we couldn't able to concentrate that. And even being with the family as a happiest person, but suddenly started yelling towards them and being very angry towards them. Actually, the feelings and thoughts which were there in the mind decides the behavior, how the person is going to be. Most often, the thoughts as well as the feelings where goes without acknowledging, and only the behavior is evident in front of everyone, as well as ourselves. So for this, first step is grounding. That is, difficult thoughts as well as the feelings which hook us and pulls away from our values. What are the values? So the values are your deepest desires for a sort of how you want to be, or how you want to treat yourself as well as others or around the world around you. So you want to be a loving, wise, attentive, committed person, persistent and responsible, calm, caring, and a protective as well as a courageous person. But in a stressful situation, when you are hooked with the thoughts as well as the feelings, you are away from the values. You will be more ailing towards that, as well as you will be isolating yourself. You will blame others, or you will criticize others, or you will feel distrust towards yourself. So these are all the hooks which you will feel more that I give up, I'm not good, I'm not hard enough to handle all these things, or it's my fault, or it's other person's fault, or feeling that I am very weak and I am crazy. And even if the person was admitted in the hospital, we will think predominantly worrying about, even without knowing what is there happening, and always having that fear, keep on ruminating about all those events which was happened and blaming others as a reason for this current situation. All those are hooking us and keeping away from your values, where these behaviors we call as away moves. So when we act on this way, we are moving away from our own values. So then the life seems to be very worse, and you will feel more stressed, and you will feel that you couldn't able to handle the situation. So then you again go into for a further stressful maladaptive strategies. Either you will argue, or you just isolate, or you withdraw. For this, you have to first engage in something with full attention. So attention towards whatever you are doing, that is focusing on what you are going to do. So if, for example, if you're talking with your family members, you give full attention towards their voice, how they express, how they are expressing their way, and what are all the things they are talking. So try to concentrate and be attentive towards what are all the activities you are doing. And if you are playing with the children, try to give full attention towards that. And if you are simply doing some work, try to, even if you are going to sip a water or a sip of coffee, just enjoy what is that cup seems to be, how hot it is, what is the taste, how it was, all those things. But very often we will be hooked without knowing that we are already hooked by that, and we couldn't able to engage in the activity. You will be distracted, or you will disengage towards that, because you are hooked by your thoughts as well as the feelings. So you will be unfocused towards the activity. So if you are not giving a focus towards that, then your activity will be in a poor quality, and you will feel more dissatisfied. So for this, you have to understand, and you should be aware that you are hooked by something and you are getting distracted. So then you try to refocus. Thereby, you can engage again into your work. So if you are hooked by the thoughts and feelings, you say, oh, I got disengaged. So I will try to refocus on what I am doing. But sometimes it will like an emotional storm, because all the times we couldn't able to identify whether it's a single thought or feelings. Sometimes it's like storm, just passing us and making ourselves to get into the storm and tip of the storm. And at that stage, how we are going to ground ourselves? We know if we are in a storm, if in a high tree, if you are still in the high, you are going to fall down. But if you are grounded, then you will feel more safe. Like that, you should understand and you should feel how you are there and how it was thinking and how you are in the emotional stroke. Then just slow down and connect yourself towards your body. So it is predominantly self-awareness towards yourself. So for this, first take a deep breath, try to breathe slowly as much as possible, or you can just press your feet in the floor or just press your hands, just making yourself to concentrate on your own body. And try to refocus the world around you. You can pay attention with curiosity, like if you're being a person going to judge what are all the things around you, how curious will be there. So those kind of attention you can try. So you can start trying that, what are all the 5 things I can able to see, and how it is, the color, texture, how it was there, how it was moving around me, like that. And you can try to identify 5 sounds around you, or some taste around in your mouth, or you can try what are the smell I can able to do now, and how you are touching your how you are able to touch, and what is the feeling was there on holding some objects, like that. You can refocus your world around you and pay attention towards your sensations. So this you can practice anytime, anywhere, even just for 1 to 2 minutes. Why we have to practice this regularly means, whenever you are in the emotional storm, you can't able to do suddenly all of a sudden, all of a one. But if you are practicing this as a routine way, at the time whenever you are in the storm, you can able to identify, and again you can able to refocus. Thereby you won't feel more stress towards that. At least you should practice 1 or 2 even when you are in a normal mood, when you are not feeling more stressed. That will help us to use the same skill whenever you are feeling more stressed, or you are hooked with more of negative feelings as well as thoughts. And instead of trying not to have those kind of thinking or thoughts, you just unhook yourself. Because whenever you try, I should not think about this, then you will be predominantly flooded with those kind of thoughts only. So you just identify what are all the thoughts or what are all the thinking which hooked you in a negative manner. You just name it silently. Okay, I'm in anger, I'm in fear, I'm having some discomfort in my body, I'm having some painful memories running in my mind. So you just name it silently and try to refocus on what are all the things you are doing. So then engage yourself, or pay full attention what are all the things you are doing, or else you just concentrate what are all the senses around you and try to refocus. So notice your difficult thoughts and feelings which is hooking you, and name the thoughts as well as the feelings, what kind of emotion, and then try to refocus what you are doing. And working towards your values. So when you are more focused towards your actions, then you can influence your world around you. So the people as well as the situations. Even in the hardest or most stressful times, you can take small actions which goes towards your values. So if you want to be a helpful person, you try to do some activity in your daily schedule for those pushing you towards the values. If you want to value others, first value yourself and be kind towards yourself and caring towards yourself. Thereby you can able to make others to feel that towards you as well. So every time when you act towards your values, just acknowledge that. Thereby you will feel more satisfied, and you will be able to sort it out all the stresses related to that. So one thing we have to accept is change what can be changed. Something in our life we couldn't able to change, but we have to accept that there is a pain which can't be changed by just thinking like that. So we have to value those, and we have to go upon in towards the next stage, where there sometimes we couldn't able to change, then move on towards the next. So being kind, that is, notice the pain in yourself as well as respond towards that. Unhook from unkind thoughts by noticing and naming them. Then try speaking to yourself kindly. If you are kind to yourself, you will have more energy to help others and to motivate others. Thereby, everyone will benefit it. And making a room, that is, for difficult thoughts and feelings, you just allow the feelings as well as painful thought, just pass it as a weather. Instead of fighting, you just observe whether it will, how it was going on. Anyway, the feelings as well as the thoughts, it's like a weather, it will pass over by time. Meanwhile, you just engage to do what are all the activities that can push you towards the values. And maintaining lifestyle routines. This was a essential thing, even if you are in a quarantine or you are, because of lockdown, you are being in in the home, and then maintaining a regular routine, like a sleep-wake schedule you can maintain. Even though you are not having enough work in the daytime, you should plan for a regular timings where at what time you are going to wake up and what time you are going to bed, and maintain the same sleep wake schedule, because sleep is necessary even if you are not doing much work because of lockdown. But the sleep wake time is necessary, where our hormones, stress hormones, as well as our body circadian clock, which all function in related to that. So even though you are not having any routine work, you should plan for a sleep wake schedule and plan according to that. And eat more vegetables as well as the fruits, where predominantly during lockdown, we will prefer to have more snacks, spicy items, but eat proper vegetables as well as fresh fruits that will help us to maintain our physical fitness as well. And try to do yoga or some kind of exercise at least 20 minutes in a day. That yoga and exercise not only make you to feel fit, it also helps to regulate your stress as well as making yourself to feel competent, and that will being making yourself as a role model for other family members. And maintain sleep hygienic practices well. The bed is meant only for sleep as well as intimate relationships, not for sitting, eating, playing, or just simply lying or reading, all those things. And try to sleep in a room where there is predominantly dark during night, and avoid multiple electronic gadgets exposure during nighttime. And have a leisure activities. Try to spend time in reading a book, or sharing your experiences with your family members, or gardening work and other physical activities, or sharing the work with the family members. Try to you may have some kind of interest during your younger age group, or just towards some music or learning something. Try all those leisure activities now. And spiritual activities, who are all interested in doing that can try that also. And cultivate healthy relationships, especially in home. You can watch how you are communicating all others, how they are expressing, and try to maintain a healthy relationships, predominantly giving more of positive affirmations towards them. So this make the adults to be a role model for the children. If you are watching too much of time with your electronic gadgets and then asking the child not to see your mobile phone, then it's not possible, because they will think, why father is seeing most often always being with the mobile, then why not me? So they will think like that. So if you want to regulate your children, you should be the first role model for them. And sharing household chores. It doesn't mean that females should be in the kitchen doing cooking. So we can share all the work, and thereby that gender inequality can be erased. Even the children will come to know that, oh, this work can be done by male also as well. So those kind of sharing the household chores, that will make them to get engaged with the work as well as maintaining a healthy relationship. Even if an older person, they can share their personal experiences, their lifetime experiences, their interested happens, which was or seeing a photo album and discussing about those past events, sharing those happiest moments rather than sharing negative moments. Better to share with the more of positive or happiest events with them. So that will help to get engaged as well. And quitting alcohol, smoking, as well as illicit drug use. My request is, those who are all taking alcohol or smoking, try to reduce the quantity and try to quit them, because this is a good opportunity for you to quit this. And try to meditate, because that will help you to be more aware towards yourself, what kind of thoughts are there, what kind of feelings are there, what are all the emotions are there, so you can appreciate those of yourself, which is helpful to make yourself in a better way. And appreciate others as well as self with more of positive affirmations. There are lots of social medias are giving more messages, but try to get the not don't get flooded with the negative messages, but stay connected virtually with your closed ones. And here, everyone is vulnerable to the stress, but those more vulnerable are those females, women population, and children, as well as the healthcare personnels and elderly population, and those who are all having economic instability, all are vulnerable. But in a current situation, is that everyone is vulnerable to stress. And a few tips in related to the children: try to talk to your child about this COVID outbreak and answer their questions, and try to share the facts rather than just giving uh, a random answers. Try to share the facts as well, and reassure them that they are safe, and ask them whether even if they are upset, it's okay to just share all those things, and try to share them how to cope with the stress, and limit your family exposure to the negative news from the social media, and try to keep a regular routine even though they are not having classes, school routine. Try to make them to follow a clear schedule, and make them to get engaged with other activities, and try to limit the screen time, and give some positive rewards towards that, which will help them to be with the family as well. And you should be the first role model, and try to connect with your friends as well as the family members virtually, and try to play having meaningful activities as reading together, making them to get engaged with a book, and introduce a book which is a friend, and exercising them, and making playing board games. So never ever hesitate to consult a psychiatrist or a mental health professional for help. And if there is any syndromal depression, anxiety, or traumatic stress disorder, or if you feel more your grieving process are getting delayed, or you are preoccupied with all those things, as well as increased use of substances, either alcohol or smoking or any other substances, try to get a professional help. And there is a predominant insecurity was there, so there are lots of helplines was also coming up to deal with this, and I'm sharing a few helplines. And there are multiple self-help groups were also arranged in related to that, and WhatsApp group was also they're planning to arrange. So those will helpful to overcome all the grief process as well. So you have to identify it and first understand and try to shrink it. Thank you for patience listening. Whatever doubts you are having, you can ask me. Thank you.
Thank you, Dr. Bharati. It was an excellent session for our institute and the participants. And the next session, I will hand over to Dr. Raghunath.
Sir, you are in mute.
So please unmute yourself.
Sir, Dr. Krishna, good evening, and all my friends. How much time I'm going to be allocated? First of all, the things I like to know so that I can plan the things accordingly. And Dr. Bharati already communicated all the things beautifully. So I like to restrict my certain things to certain topic only. Dr. Krishna, are you there? Hello?
Yes, sir. Yes, sir.
But you are not,
Audible.
But you are not, see, I cannot see you in a video. That's why I just asked.
Okay,
Dr.
okay.
Krishna, see, I think I can take half an hour.
Yeah. Half an hour on psychotherapeutic interventions.
Okay. Do one thing is that I want to, rather since I'm a professor, I'd like to have an interaction so that we will communicate, a little bit better. Am I right,
Sure,
Dr.
sir.
Krishna? So I'd like to ask you one interesting question. You are also a doctor. That's why I just asked you this question. You might have heard about the cobra bite. Okay, sir.
Cobra bite.
Yeah. How many people are dying because of the poison alone?
If they're not reached to the hospital, then the chances are dying is more high, maybe 90%.
Yes, sir. Okay, I want to tell you, see, whether the poison is only the reason for the death, or whether the mind confusion is also reason for the death.
Timely decision reaching the healthcare facility.
Yeah, and see, you know that it is because of the mind attitude towards the particular cobra bat that is also causing the death. Am I right, sir?
Yes, sir. Yes, sir. The
So
tension after
it's
getting bite,
all your mental
they are
attitude.
confused.
Am I right?
They are mostly confused with what to do, and
Yes, yes.
bite pain
That
and
because of
bleeding.
that shock, it is really coming. Am I
Yes.
right, sir?
Yes, sir. Yes, sir.
Shock is also one of the factor which is causing the cobra death. So in this pandemic situation, I like to ask Dr. Krishna, why you have conducted such a session? I like to ask you this interesting question because I'm a positive psychologist always. I like to give you some positive aspect, Dr. Krishna. Why you have
So
conducted?
most of our faculties, as well as the students, as well as the public community, they are stressed during the COVID period, as well as lockdown, rising deaths, and we every day we are getting messages from our friends and family members, positive, isolated, quarantine, hospitalized, deaths. Every day we are getting messages from our friends and family networks. So we want to cope up with our family situation as well as the environment. So that's why we are planning to conduct.
Exactly, sir. I do agree with you that the corona situation, pandemic situation have created a lot of confusion. But those people who came for such a kind of treatment in my hospital, it is observed that, see, their mind is already weak, not because of the corona situation. Right, sir?
Yes.
Those we are giving the really the treatment. Understand, sir? It is
Yes, sir.
not because of the corona situation alone the stress is coming. Because of the mind is not perfectly okay with the particular person, or their mental health is not absolutely okay. Because of that, they are coming to our hospital and getting the treatment. It is not because of the corona situation alone. Sir, I want to tell you, no law have produced by any nature or by the God without a key. I told you I am a positive psychologist. I want to communicate only the positive things.
Sure, sir. So
No
every lock
laws
is
have,
manufactured with key.
available without a key. Am I right, sir?
Yes, sir. Yes, sir.
So
Agree, sir.
there is a key for
100%
all
agree.
situations, every problem. Am I right? And I
Yes.
like to ask Dr. Krishna another interesting question: whether this is the first pandemic situation we faced earlier in our life or in the world?
No, we have faced so many pandemics in the life. This
We
is
could
the second
overcome all
wave.
the situation. Am
Yes,
I
yes,
right?
yes.
We could overcome all the situation, and we will be able to overcome this situation. That is the first message I want to pass to all my friends, because it depends upon your mental attitude, sir,
Yes,
how
sir.
we are facing the stress. See, without your knowledge, the stress is not going to enter into your body. Am I right, sir?
Yes.
You are the person. See, I will define mine like this. It's a garden, sir. It is having 4 walls. Okay, sir.
Okay.
And there is having a gate. Gate is also there in the garden. Right, sir? Gatekeeper is you. Am I right?
Yes.
What are the things you are allowing to the enter into your mind? It is entering. Am I right?
Yes, sir.
If you are entering bad things, naturally, bad
It will
things
go
will
to
also
the.
come. Am I right?
Yes, yes.
See, as
Bad things
Dr.
will be locked
Bharati
out.
said, in certain situation, positive stress is also good. But in certain situation, the negative things which you are going to enter into your body or your mind is going to create a lot of issues. It is not the corona situation alone, sir. This is what I want to tell you. This is the important thing. Because of the corona situation, I sadly witnessed of many deaths and met with their kin. So I have observed, no, I couldn't complete the message. So it depends upon how to solve it, sir. Right? Am I right, sir? It is
Yes,
not
sir.
the corona situation alone which is causing the problem, stress, because stress is the first step which will lead to other psychiatric issue, as Dr. Bharati said. So we have to really cut down the stress from the beginning itself as a first step. I'm a preventive health, consultant. I believe in prevention of something because I'm a positive psychologist always. I never wanted to give you a negative things. Sir, I just want to tell you an interesting survey, because when we are talking about media, I am also a media person, sir. I do a lot of media, writing, and I'm also a columnist, and I do a lot of positive interviews with various TVs.
And what type of security measures you are going to build in this application. So all
Pardon,
such
sir?
factors have been clearly told in this book.
No, sir.
Are
I
you
am not
clear?
able to hear you. See, Krishna, sir, I am not able to hear. See your video, sir. So I ask you one interesting question: whether you have gone through the, sir, the John Hopkinson survey on 10th May about the safest country to live. Krishna sir, are you there?
No, I have not gone through that.
Yes, sir. See, one thing I want to tell you, sir, they have given, if the data is given, I mean, share the data also to you so that you can share to everybody. The safest country, as far as, I mean, John Hopkinson's, I mean, this thing is concerned, it is India.
Okay.
Right, sir? As far as the data is concerned. So we should also, I mean, look into such a kind of angle, sir. Right? Instead of that, totally we are taking the negative things. It is because of the media people also, because they are creating situation and doing a lot of confusions. Am I right, sir?
Yes.
Social medias are doing, and whenever you are taking, I mean, rather the newspaper, you are getting all sort of negative things, right? Death.
Yes.
Why we are not concentrating the recovery part? Why we are not concentrating how much, I mean, rather the vaccine given to entire population? Am I right? Not entire
Yes.
population, a part of population. Such
Population.
news are not coming. So this is really causing, I mean, rather the confusion in the pandemic situation. This is one of the factor for really this, I mean, rather the stressful atmosphere. You agree with me, no, sir?
Yes, sir.
And I
Agree
will
with
come to an interesting thing, sir. See, one thing I want to tell you, sir, Dr. Krishna, you are also a teacher. You are also a parent. That is what I want to tell you. Am I right, sir? You are also a teacher. Sir,
Yes,
you are
sir.
teaching your students to get the pass mark or getting the, I mean, rather the good marks. Always no, sir.
We always prefer to give a pass
So you
mark.
are concentrating only on the win situation. Am I right, sir?
Yes, win situation.
So whenever there is a negative things, whenever there is a, I mean, failure, we are not able to face the situation. Am I right, sir?
Yes.
So in the educational system, I was arguing this point with one of the people, person who, I mean, really now, I mean, formulated the new education policy. Okay, sir. About this particular point, we are not really giving any training to face, especially the failure situation. We are only, I mean, our parents are giving such a training, our teachers are giving such a training to get only the success situation, not to face the failure situation. So we are not able to really face the problems. Am I right, sir?
Yes, sir. Coping
Every
situation
problem
for
is an
failures.
opportunity to solve. Am I right, sir?
Yes, sir.
You know how to play the cricket, sir?
Yes, sir. I know. Yes, I
Yes,
know.
sir. Once the bouncer is coming, what you will do, sir?
What
Though you have a
bouncer?
helmet, once what you will do?
During?
Once a bouncer is coming, or I mean, you can understand a beamer is coming towards your head, what you will do, sir?
I will check my helmet whether I am wearing properly. It can protect me
Before
or not.
I mean checking your helmet, the ball will hit, sir. So what you will do?
I will change my position, location,
Location, or you will tilt your
head.
head. Am I right, sir?
Yes, yes, yes,
This
yes.
is only possible when you are opening your eyes. Yes or
Yes.
no?
Yes,
This
yes,
is
yes.
what I want to tell you. Face the situation. Don't run away from the
Situation.
situation. Face the situation and finish the situation. Am I right, sir?
Yes, sir.
It is possible only for the case of the, I mean, students, or rather the person who can really have a good emotional cohesion, or whether, see, in general, I want to tell you that mental strength. Yes or no?
Yes, sir.
So in such a kind of situation, we are supposed to give the mental strengthening effect, not only in the COVID situation, sir. Throughout our career, throughout our parenting, we are supposed to give to our, I mean, young children, adolescent and youth, so that they will be very bold. Am I right, sir?
Yes, sir.
Shall I tell you a joke, sir?
Yes, yes, yes. Sure, sir.
Yes, sir. See, our Chandan, you know,
Yes.
he has done a mischievous thing to me, because he is also hearing. Sir,
Okay.
see, one thing, can I tell that joke? See, we
Yes, yes,
were
sir.
I mean,
Yes,
traveling
sir.
together.
Yes, sir.
No, sir, Dr. Krishna and me was traveling together, and we were just moving. So,
Okay.
Chandan, I am going to reveal the entire story now, because
Okay.
Dr. Krishna don't want to, I mean, reveal it.
No,
So,
Sure, you can
yeah,
reveal
sir,
it, sir.
I am going to tell this entire story. See, Dr.
Yes.
Krishna is my friend, and me and Dr. Krishna was moving, and we are so close, so we were, jointly together, and we were just moving in front of the house of Chandan.
Okay.
Chandan didn't like, sir, but he has done no.
Uh,
He just, got off the Alsatian dog from that. Okay, sir,
okay.
and asked to chase we two people.
Okay.
See, viewers can understand that Dr. Krishna is so strong mentally,
Mm.
and I am very weak. From the presentation itself, you can understand I am very weak. So
Okay.
what Dr. Krishna might have done, what me might have done, you can understand. I
So,
ran away from the situation,
yes, I will throw a stone against the dog.
or you will be just, looking back. Am I right?
Yes, yes, yes.
So who will, get the, dog bark?
Dog.
You are there, but
Yes.
I have ran away from the situation.
Yes, yes, yes.
You know pretty well as a doctor what happened to me also. The dogs are, running away behind the what, sir? Vibrations. Yes,
Yes.
or no?
Yes, yes,
So
yes.
I finally got the dog bite.
Yes.
So, sir, same situation, no? Dr. Krishna faced the same situation. Me also faced the same situation. Then how did I get the dog bark? Dog bite. Not
Dog
only
bite.
bark, dog bite also.
Bite also.
How I got it, sir?
Because we are
It is
not
simple.
facing.
You have faced the situation. Whereas I have run away from the situation and I face the problems, consequences. That is the stress parameter, right, sir?
Yes, yes.
It's all depending upon your attitude, how you are going to take it. If you are going to take negative things totally, sir, one thing I want to tell you, you are going to become a negative person and totally stressed person, which will be benefited for psychologists and the psychiatrists. Or rather, I want to tell you, Joe. Am I right, sir?
Okay, sure.
See, one thing, sir, now Krishna sir is smiling. So what I have done, I started also smiling. Am I right? This is an infectious disease.
Positive.
Now, this is an infectious disease all over India. All the negative people are, transmitting stress. What the point? All the negative people are transmitting stress. So everybody is going to get the stress. It is an infectious disease. Instead of that, Dr. Krishna, Dr. Deepa, Chandan, me also, and Dr. Bharati also should transmit positive aspects. I'm a positive psychologist. We will be able to overcome all these situations, sir. Once see all this, vaccine is given, right? Definitely, we will be able to overcome all these situations. Am I right, sir?
Yes.
Only thing is, we have to wait for the particular time. I used to teach my psychological students, Dr. Krishna, one interesting thing. I got patience because I got patience. Am I right, sir? Yes. I got patience because I got patience. So this situation requires patience, sir. This is only possible when you have got a strong mind. Agreed, sir?
Agreed.
This is my concept I want to tell you. So instead of, teaching the students or our young ones only for the success, we should also train them to face what's the failures also. That will give you really the mental immunity, not only physical immunity you are talking, sir. As a doctor, you will be talking about physical immunity. As a psychologist, I want to talk about the mental immunity, sir. Definitely some sort of failure should also come. Then only we will be able to understand exactly the importance of success. Am I right, sir? Yes. So this situation is giving you some mental immunity. Agreed, sir? If you are really able to overcome your, the self-esteem will be very high. As Dr. Bharati was communicating, we should start, believing in ourselves. Sir, I used to teach my students, first of all, in order to love anybody, in order to say, Dr. Krishna, that 143 or I love you, I should say first, I love myself. Am I right, sir?
Yes.
Only person who is loving the person
Themselves.
will be able to love others. Only
Others.
the person who is motivated can be, motivate others. Only the person who is smiling can get back the smile back. Am I right, sir?
Yes.
It is like a magnet, and rather you can understand. See, magnet always will attract iron. So a positive situation we should create, sir. Your students, your faculties, including me, should create a positive situation. Definitely, we will be able to overcome the situation. Most of the situation is caused by the negative spreading of the message. I am also sir, I told you, that columnist, but I communicate only the positive, this thing. Sir, I want to ask you one interesting thing. During the pandemic situation, I am going to talk about the positive things. During the pandemic situation, whether the communication, the family increased or not.
Increased. Definitely increased.
So it is
Every
a
day
positive thing. It's a positive thing. See, before the pandemic situation, see, most of the people means 40% and 30% people, they are really, addicted to two kings, sir. Two kings.
Two
Shall I
kings.
tell you two kings?
Yes, yes, true.
It is one smoking, king. Second one is drinking.
Drinking. Two kings.
Yes or no?
Yes.
Now, whether the smoking and drinking reduced, sir?
Yes, definitely reduced.
It is reduced. As Dr. Bharati said, this is an ideal situation to overcome such a kind of addiction. Am I right, sir?
Yes, sir.
And say, I want to tell you, as a Dr. Krishna will be telling that before the pandemic situation, a lot of antibiotics were sold. Now what about the antibiotic, industry now? It came down like anything. Yes or no, sir?
Yes.
Because we started using the mask. So every situation, there are certain positive things, certain negative things. When you are concentrating only the negative things, you are going to become a negative person. When you are going to concentrate the positive things, definitely you are going to become. Because as I asked you the question, in the case of cobra bite, you were talking not only the poison, it is also the case of, rather the shock, it is creating the death.
Yes.
Am I right, sir? So we should be able to really face the situation, not fly away from the situation. 3F, sir. And I want to tell you, sir, we Indians, yes, definitely will be able to finish this kind of negative situation. Finish 3F, sir.
Oh, okay,
Am I right, sir?
Yes.
Face it. Don't fly. And we'll be able to finish the problem also. Sir, I will tell you an interesting thing that will be, quite benefited to all the students, sir. Okay, sir.
Okay, sir.
According to me, I have given the stress like this, sir. Okay. Before coming to that particular point, Dr. Krishna, when you are coming to your college, what are the things you are morning expected from the college or from the morning, from your family, sir?
So I should wake up at time.
Okay.
And
I think you are waking up at 8. That's why you are,
No.
80%. No, I just joke, sir. Okay, you are my
I
good.
should wake up.
Layer what it is going to perform, we are going to see one after them. Are you clear?
Hello? Krishna, sir, are you there? Hello?
Krishna, sir, you are muted. Please unmute yourself.
Yes. Am I audible?
Yeah, Krishna, sir, you are audible. You are,
Okay.
Okay, sir. Morning, what are the things you are expecting, sir?
On time
After
wake up.
finishing your breakfast and other things when you are going to.
And pack my luggages, whatever I need to bring it to the office.
Then afterwards, mental expectations, psychological expectations?
Mental expectations, I usually go by walk to my office. So I have a fresh breath and fresh greeneries in front of me, and I'll go for a walk.
Your surroundings, sir. Psychological expectation?
Psychologically, today I should finish the task, whatever given to me and whatever challenges to me.
Yeah, that is your target, sir.
Yes.
But one more thing we will expect, sir, right? There should not be any screwing from our family members, especially from the wife. You are married, no, sir?
Yes, sir.
There should not be any screwing from our Dr. Geeba, Dr. Lakshmi. Am I right, sir?
Yes, sir.
Am I right?
Yes, sir.
So what we expect, there should not be any happening. Agreed, sir?
Yes, sir.
This is wrong, sir.
Hmm.
If you are leading a life means always stress factors are part of your life.
Yes.
Don't expect, a sub-inspector should not expect a screwing or from his senior circle inspector from the DYSP. He should expect. And of course, Krishna sir, as a lecturer, we should also expect screwing from our students also. Am I right, sir?
Yes.
Vice versa also. Now we are facing a lot of other issues.
Challenges.
Yes,
Yes.
sir, no, sir?
Yes, sir.
So happenings are all what, sir? So according to me, stress is nothing but hero, sir. Okay, sir?
Okay.
Stress is nothing but HERO.
Hero.
See, the problem is you are concentrating or not expecting that H not to happen in your life. Don't expect. It is part of your life. Whenever you are especially growing, right? You have to expect a lot of happenings in your life. Am I right, sir?
Yes.
But I want to ask you the question again, but without your knowledge, sir, without your knowledge, whether these things can enter into your mind?
No, with my knowledge only it will enter. I know
Okay.
what and all going inside.
Okay, sir, one thing I want to see, you have, I mean, sir, your mother is with you, sir?
Yeah.
What is the pet name you used to call, sir?
Oh, mother, I don't have any pet name.
No, sir, you have got a pet name. Don't lie to a psychologist who is working with police department, sir. Just so, Krishna, am I right?
My mother called me as a Krishna, but I don't have any pet name for my mother.
Okay, sir.
I
Your
used to
mother
call-
used to call Krishna, am I right?
Yes, yes.
So, mother used to call you in the morning, Krishna, get up, it is already afternoon. Okay. Likewise, he used to call, but you don't feel anything. Suppose if I call you, Krishna, what you are doing? Sir, it is a situation.
Difference
It depends
between
upon the person who is calling. Am I right?
triggering. Yeah,
And how you are
triggering.
going to take. Am I right, sir?
Yes.
It is called the E. It is called the evaluation, sir. This is most important.
Mhm.
Happenings are part of your life. But based on the evaluation only, you are getting the stress. Am I right, sir?
Yes.
Okay, sir. Sir, a person is going. I think he is having some schizophrenic issues, right? Okay, sir. Another person is calling man. He doesn't understand anything, or he is not evaluating anything. But suppose a person is calling me man, definitely I will evaluate something else and I will get stressed. Am I right, sir?
Yes.
It's all your evaluation. Stress is coming because of evaluation. I'm not only talking about the, pandemic situation alone, sir. I'm talking about the total stress situation. I'm talking about the, how to, really work out in our personality in such a way that how we will be very strong mentally. So we have to change our evaluation. Am I right, sir?
Yes.
So whether we will be able to avoid the happening, sir?
No, we cannot able to avoid happenings.
That
We
is
have
the
to
situation.
cope up with
That
it.
is the situation now. We can't avoid the happenings. It is a part of that. But we can avoid the evaluation. Am I right, sir?
Yes. Yes.
Exactly. That is what we are trying, sir, to change the evaluation or such a way we are going to increase the mental strength of a person, for which we have started along with the NCPCR, Department of Police, so many projects online counseling. Right, sir? See, as Dr. Bharati was, sharing so many numbers, we can also have, NCPCR's numbers for your adolescents, sir, for your youth people, for your students, for your faculty members. Am I right, sir? Sharing itself is a big therapy. Am I right, sir?
Yes.
If you express, yes, stress level is low. Agreed, sir?
Yes.
If you suppress, some sort of expression will come. That is the stress. Agreed?
Yes.
See, a person, Dr. Bharati was, communicating about the suicide, right, sir? I used to work a lot of things, regarding the suicidal, anti-suicidal projects there. So I want to tell you, a person is deciding, I'm committing suicide because I got a big problem. I'm not able to solve myself. Am I right, sir?
Yes.
But if I am communicating to my good friend, Dr. Krishna, he may be giving some suggestions, right, sir?
Yes.
So sharing itself can give lot of
relief.
It is the basic concept of counseling, sir. Sharing. What the point, sir?
Yes.
Work a good network of good friends, not all India radio friends. You know why? Now, once we are reporting to the concerned friends, Dr. Krishna, problems will be, transmitted to some other station. It is not like that, no. Develop good friends who can share. We can share our problems. Am I right, sir?
Yes, sir.
So sharing also is a very important thing. So when you are sharing the problems, no, naturally we will be able to solve the problem. Right, sir? See, you just take the case of, sir, once again, I'll come back to the evaluation point, sir. See, two of your students are, one students are getting 90% of marks. One person is getting 45% of marks. He is, rather going or to the, a problem. And the third person, no, sir, okay, he is scoring only 30%. Okay, but he is ignoring, whereas 40% person who got the marks are going to commit suicide. Why? How he is viewing the particular situation, sir. For this kind of three people, the situation is same, but how they are viewing the situation, that is important. This is very important in the case of stress management, sir. That is what I want to tell. Always the prevention is better than cure. Am I right, sir?
Yes.
So prevention we have to work out. That's why I want to tell you, we have to really teach our students how to face a failure also. I'll tell a story, sir. One particular person, I will not name the particular, this is a real story which, came for some case study or something. He got good marks in SLC, sir. Very high marks. After that, he got flying colors in +2, sir. Then he joined with IIT, right? After writing the state. After finishing the IIT, he was a topper. He went to, America. He got, lakhs or crores and crores of rupees salary. You might have heard about this story, sir.
Yes, yes.
See, during that particular time, some financial crisis came all over the world. It is decided by the company that the young person or the junior fellow should go outside. So it happened. This person was moved off from the company. So he was continuing in America, sir, right? Trying for some other jobs, but he couldn't get the exact salary which he got as the first job, sir. And finally, after 6 to 7 months, what happened? No, sir, he committed suicide. Why? In his life, totally faced only the success. Am I right, sir? If he faced some failures in his earlier life,
then he is able
he made out, overcome.
With
yes or no? So failures are part of success. So when you do something, as far as I am concerned, I want to tell you only thing: a result, sir. It may be success, it may be a failure. If failures, if you are getting some interesting points, we are avoiding certain that interesting points from the next time, and we are going for a success. So failure is a part of success. Am I right, sir? This should be your mentality in facing the situation. So, yes, you can understand happening. Happenings are part of our life, sir. E is your evaluation. And based on evaluation, what is your response? That is R, sir. Based on your evaluation, what is your response? How do you respond? If you feel that, you are, out of the game, then you are out of the game. Whatever you are thinking about yourself is exactly you, sir. Am I right, Dr. Krishna?
Yes.
Whatever you feel about you is exactly you. Actually, every problem starts with your mind, especially the stress. So in this particular situation, or along with, the
response.
yes, sir, there should be some sort of syllabus included in the 8th, 9th, 10th, so that we are really able to face the failures also, to improve our response, right, for the failures or stressful situation. Agreed, sir?
Yes, sir.
So based on the response only, yeah, output. The output, if you are having a good evaluation, as you rightly said, Krishna sir, you will be able to overcome the situation. This is hero concept, sir. This I can take, hours and hours. This is the concept I used to take for ACT people, sir. I used to take almost one day based on this concept, sir. So happenings, don't expect it will not, there will be some screwing from your department, colleagues, sir, your students, even from you can expect some problems from your friends also. But how you are evaluating, how you are, responding, how you are, based on the response, how you are outcome, that is going to be more important. Krishna sir, you are again off from the video. Anyway, that is the thing which I want to communicate, sir. So prevention methods, Krishna sir.
Yes, sir.
Dr. Bharati already communicated a lot of interesting prevention methods like yoga. It is good. It is look good. Yoga can give some soothing effects for your mind. Gardening also can give some this thing. And Krishna sir, I want to tell you, this is an ideal time to do a lot of courses.
Learning courses.
Learning courses. See, one thing, you have to thankful for the corona situation, pandemic situation. Because of that, Krishna sir and me and Dr. Deepa and Dr. Bharati is, communicating each other. Otherwise, you have to invite me to Bangalore and take classes. Am I right, sir?
Yes.
So you have to utilize this platform.
Discussing here, please.
You have to use this platform for doing certain courses. If you are so much engaged, definitely the stress will not be there or the boring will not be there. See, as far as the adolescents are concerned, I want to tell you, or the youth is concerned, because of the boring situation, because they are not really able to do anything, they are getting bored and stressed in such a way that actually this sort of stress is really developed. So see that your time is creatively used. There should be a real timetable for whatever activities still you are doing. And there should be a time for the exercises also. As Dr. Bharati was communicating, when you are doing certain positive hormones, when you are doing exercises, certain positive hormones like DOS, or she will be telling more about those, etc. That is, some positive hormones will be, rather coming to your body, so that you will be able to really face the situation. Listening to good light music, not the, the songs I am talking, it can also reduce your stress. And you have to limit your, food also in such a way that you should not become overweight. If you have taken a survey of yourself itself, if you have taken before corona, what is your weight, and after corona, or see now what is your weight means, you can understand that at least 2 to 3 kilo you might have increased that. We are becoming lethargic. So this sort of things we have to do: gardening, yoga, sharing with the friends, and reading the positive news, avoiding the negative social media or the news also can really create a lot of things, lot of positive things in your body. That is what I want to communicate. Dr. Krishna, I think we are supposed to wind up by 6:30. It is already 6:39, and so many questions are also supposed to come.
Yes, sir.
Dr. Krishna, I think in fact, I have prepared one exercise, that is a meditation exercise. Next time we will do that also, because it will take 10 to 15 minutes. Okay, a relaxation exercise, which I will give you next time. Okay, over to Dr. Krishna, and I really thankful to Dr. Tiba and Dr. Krishna for giving us such a kind of opportunity to interact with all the people, especially to Dr. Krishna for helping me to interact and communicate the message, because all the, professors, when they are using this kind of media, we will interact so that the people can understand more. Nice of you, sir. Thank you.
Thank you very much for your nice presentation, sir. We will hand over to Dr. Deepa for question and answers. Over to Deepa.
Yeah, thank you so much, sir. I would like to take up the first question from Tarun Vaishnav, who says, I'm visited many COVID hospital and sadly witnessed of many deaths and met with their kin. So I have observed that they are nowadays easily accept the deaths as it takes time before COVID pandemic. So is there any, sorry.
Yes.
So there is a concise the graving process in it. So over to you, Professor.
Okay, Diba ma'am. See, just think about our grandparents, right? See, definitely our grandparents' death caused a lot of concern for us. Am I right? Because they were loving us very good. Now, when I talked about the grandparents to Dr. Diba, see, Dr. Diba, your grandparents are still alive?
Yes, sir.
Yeah, you are very much attached to them now?
Yes, sir.
Both are available. See, take the case of somebody else. See, they maybe, just having a scene when I talked about that. They could really able to forget this. Am I right? So time will heal all this. You have to give certain times. But if you are going to the hospital, continue your work to the hospital, because we are serving the society. Dr. Diba, every day I'm going to the hospital and serving. That you can understand that, see, with PP kit and other things, you can understand our difficulties. No? See, with overcoat and PP kit and others. So one thing I want to tell you, Dr. Diba, in the long run, this is a psychological concept which you can pass to every of your students. The people who are givers are always happy. They will get happy. The people who are always receivers, they will be less happy, or they will not be much happy. So he was giving some support to the hospital. So he is giving rather, he is a giver. So let him continue. Finally, he will be able to overcome all this stressful situation.
One more question for Dr. Bharati. For sleep disturbances during stress, can we take sleeping pills on and off? I think it's a very serious question. Dr. Bharati?
Sleeping pills without advice by the physician or psychiatrist, it's dangerous, because often they will get the medications from the medical shops as just taking 1 or 2 tablets whenever they need it. But actually it will produce more of dependence towards that, because they will think that only by taking those medications we are getting into sleep. But actually most often these stress-related sleep disturbances can be handled without taking medications itself, like other sleep hygienic practices, avoiding tea, coffee, as well as alcohol or smoking during the evening times after 4 o'clock or 5 o'clock, and going to the bed at a regular time, and before going to bed at least off towards any electronic gadgets for an hour, and maintaining sleep hygienic practices like not eating too much during the night, and just going after having the heavy meal, just going to bed, and other things like just keep on checking the mobile or watch whenever they are awake, and thinking that whether this one day of sleep disturbances will affect their life, or having too much of negative attitude or cognitions towards that sleep disturbances. And most often they will think that if we didn't get night sleep, then it's good to have a daytime sleep. But if they have a daytime sleep, then it will affect their night sleep quality. So even though they couldn't able to sleep on that day during night, just wait and just postpone and do get engaged with some other activities during the daytime, then your sleep will get better, and the next day, as the days go on, your sleep will be more better in quality rather than sleeping in during the daytime. So having frequent naps during daytime and sleeping more during the morning time, where actually the light is an important factor which reduces the sleep quality. So during night, maintaining a darkness in the room, and having not having too much of light and waking up in the morning, that will be helpful for maintaining a sleep. So if you are continue to have sleep disturbances, for example, if you are continue to have sleep disturbances where you couldn't able to sleep properly, and you are feeling more tired during the daytime, and you couldn't able to sleep during the early morning hours, and you are feeling more tired, then it could be a reason for your depression. So depression has to be addressed rather than just taking sleeping pills as a remedies. So it's better to avoid those sleeping pills without any knowledge or without any prescription, and better to consult a psychiatrist or as a professional mental health professional to rule out is there any other underlying depression was there.
So better than pills to follow the sleep hygiene. That's what your suggestion.
Yeah.
Dr. Devasri, also
we have one more question. Yes, sir.
see,
yes, sir,
if you
Professor.
can take, if it is an youngster, see, adding with the Bharati ma'am's point, I can give you one more point. Exercises, right? Evening, if they can walk 2 or 3 kilometers, definitely that will, enhance your sleeping pattern, right? One. Second thing is, see, if you are taking a glass of milk just before, going to the sleep 1 hour, it will induce sleep. This is clinically proven, right? Because certain amino acid, I think Dr. Bharati also will agree with me, certain amino acids, certain chemicals in that, it will increase the, sleeping pattern. And just before going to the sleep, if you can take a bath, right? Just with a hot water above your body temperature, it is observed that just 1.5 hours, before, if you are taking it, that will reduce the temperature slow, that will induce the sleep. This also can be tried.
I agree with you, sir. Being a Ayurvedic doctor myself, yes, milk, glass of milk at night increases the tamo guna, which induces the sleep for people. Yes, I do agree. So we have one.
There is no requirement of Manasamitra there.
Yes, sir.
As Dr. Bharati said, see, we don't require alprazolam or the, lorisib. Am I right, Dr. Bharati?
Yes.
Sir, now one more question, I think maybe related to the person lost their loved one, family member in this COVID period. How can we compensate? I think you have already stressed on the point on that. Hello.
Question is to me.
Sir, I think you have already answered. Maybe you wanted to highlight a few points on if a person lose their loved family member in this COVID period, how can we compensate in this situation of the high stress level? So a few points to cope up on that.
See, you are asking the question to Dr. Bharati or me?
Professor, for you, then we'll take a Bharati ma'am's answer.
Okay. Yeah. See, I already communicate that the time will heal all your problems, right? It is not the COVID situation alone. Because of COVID situation, such a question came, right? Am I right? So time will heal. And of course, Dr. Deva ma'am, reality is always reality. When you expect something, right, which is not there, it is causing stress. But when you accept the reality, of course, stress will be very less. And of course, the time will heal the emotional attachment, right? Any relationship depends upon the emotional attachment as well as the communication. But communication is not there. It is, slow by slow, it is going. Am I right? So definitely that is going to, rather improve your, rather the mental stability or the mental health in a such a way that you will be able to overcome. But accept the reality.
Over to you, Bharti ma'am.
Added to what Sir mentioned, one thing is, first we have to think what is the underlying thing, whether they will have guilt because they will think that the father or loved one was not cared by themselves and they left them in a quarantine room and they died without seeing them. So all those issues has to be addressed. So we have to first assess whether in which state they are, whether they are still in shock state or still in depressed or in bargaining state. So in what kind of stage they are, then we have to assess further whether they will have underlying guilt or sadness and what kind of emotional attachment with that person. So later, as Sir mentioned, first start accepting that there is a loss, and which was in our culture also we mentioned that if there is a birth, there is a death. So that is the reality. Each person, whoever born to this world, has to have to go through all these things. So the process of death is a natural thing. So even I or other anyone is going to have a death in their life. So trying to accept the reality and what are all the underlying pins was there, which was underlining these kind of stress too much, how much it was attached with them, and what are all the preceding events and how it was taken into a stressor level, and what kind of other stressors there may be. He is the one giving more support towards that person, or he is economically supporting them. So those kind of losses and other loss of social support in related to that person has to be addressed, and then they can slowly thought what are all the good things was happened with that person and how to imbibe or how to transmit those love feelings towards them to another object. Either that could be their photos or those rituals. So those also will help them to grieve and overcome those stress. So the grief itself, as a separate session, we have to understand now, because lots of people, not only loss of their family member, also just diagnosed as a COVID positive and being separated from their family and lost contact with them and not able to approach them and not able to help them, or so those kind of losses also has to be addressed in grief. So these everything has to be addressed, and I think this grief itself needs a separate session.
Okay, ma'am. I think accepting the reality and moving on is what you wanted to communicate. And yes, the grief itself, grief management and grief addressing is itself a very big chapter to discuss. Ma'am, the last question is from my student, Chandan. Can you ask the question?
Yes, yes, ma'am. Yes, ma'am.
Yes,
Actually,
Chandan.
the question is for Professor. So actually, I would like to ask, sir, that what if we are having constant contradiction in our self-decision, sir?
Okay, see, this is a very interesting question Bharati ma'am asked. See, there lies Dr. Debasri, the concept of SWOT, SWOT analysis. So there, the concerned person's weakness he is highlighting, whereas his strength is not highlighting. Okay. So once the strength is highlighted, once he understanding the weakness, he will be able to overcome this kind of situation and he will be able to take a decision. Am I right? That SWOT analysis we have to teach our students, Dr. Devasri. That is what I understand. We have to really, communicate about the SWOT evaluation. One thing I want to tell you, Dr. Devasri, for the, interesting information to our students. See, when India is playing England, okay, when India is playing England, there is a possibility of India winning the game. Dr. Daibasri will say that India will win the game. Am I right? But there's a possibility that England also will win the game. Those who are playing the game always having the chance of winning the game.
Losing.
See, the people, those who are not taking any decision, They are watching the game in the life. What the point? So they are not really able to win the game, or rather failure, but their life is a failure. So first of all, I want to ask all my young colleagues, you take the decision. See, Dr. Divasri and Dr. Bharati will, remember one particular incident when Narasimha Rao was, rather interviewed after the cabinet meeting. They asked the press reporters, what is the decision you have taken in the first meeting? Yes, we have taken a decision today that we are not concluding anything today. So that is the mode we should have. We should take a decision now. There is always a, risk, but without the risk, there is no innovation. Without the risk, there is no innovation. Dr. Divasri, I am a down-to-earth person without any ego. I want to tell you, without the risk, there is no innovation. I am the person who won 2013 Innovation Award of Kerala government. That's why so I can say without risk, there is no innovation. So take the decision, take the risk. I think Bharati ma'am will also agree.
Yes, sir. Shall I add few things along with this?
Definitely, ma'am.
Actually, the Chandan mentioned about self-contradictory decisions, right?
Yes, ma'am.
Okay. There is two things which make you more stressful. Either it's a frustration or a conflict. So frustration is the one when you are planning to do something and your goal was about to reach, but it was disturbed. So you will feel more frustrated. And a conflict is the one where you will have both, you may have some positive attitude towards the same kind as well as the negative attitude. For example, if we are in a lockdown, so we have a positive attitude that we should not go out and thereby we can prevent getting an infection. But at the same time, we will have another attitude that we want to go, we thought of moving away, we plan for a vacation, we plan for a get together, and we want to spend dine out like that. So when there is a two kind of balances where there is a positive as well as a negative, then there is a conflict. So for this frustration, you have to, first you have to think what kind of problem was there, why it became as a contradictory decision. Either it's a frustration, whether your goal was disturbed or there is any conflict. In that case, if there is a disturbances in your goal, whether you are reaching your path is disturbed, you try to find out and you solve that problem. So what are all the things we have to make it a simple, small task as well as small goals. Set a small, little attainable goals and try to overcome and get into a step-up procedure. Like if it is a conflict, then you have to think whether what are all the positive things which is going to happen if I take this kind of decision, and what are all the negative things will going to happen by this decision. So you have to balance which side you are going to be, then take a decision. So that will help not to make a contradictory towards yourself. And most often we will think that we will get many people advice. We will get more advice and we will feel more confused, and then we will go with someone else's advice, someone else's decision. Then you will feel more that, oh, I couldn't able to overcome this. Why should I take these kind of decisions? Like that, then you will feel more yourself in a self-pity. So that should not be happen. So you can start work up with before taking a decision, whether it's which side I'm going to be. So that will help. Even you can learn this from your past experiences. Even though if you made multiple contradictory decisions and had multiple failures, it's nothing wrong. You can learn from this, and then you can try with the next, what are all the problems you're going to face, try to overcome all those with this experiences. That will be more helpful for you.
Thank you.
Dr. Bharati ma'am presented beautifully. So don't be a footballer of others.
Ma'am, we have one question from our YouTube viewer, which says, the question is to Professor, it is regarding the death grief. Time heals the grief, but maybe the loss of communication and emotion. but same time you told to face the stress because the grief brings lot of memories with that person. Sir, how to manage both the stress and the grief? Over to you, sir.
In fact, I already answered this question. That is the increasing of your mental strength, right? Face the situation, right? Because this is not the problem of COVID situation alone. Definitely, see all the death who are very close to me. For example, Dr. Devasri, I don't have father and mother. Definitely, I had a lot of issues because emotional attachment is there. But the emotional attachment, when the communication is not there, slowly will go, and we will be able to, engage with our daily activities such a way. But if it is not able to be controlled within, I say, 15 days or 30 days, as Dr. Bharati Rajendran was talking, you should meet a mental health professional, including a psychiatrist or a psychologist. Sometimes actually, Dr. Devasri, what they are doing, they have a feeling that they will be able to control. And finally, that will lead to some other issue. And then finally, they will be reaching to Dr. Bharati or me, and we will face very difficult situation in managing. So initially, if itself within, short period of time, if they are not able to control it, let us meet, our health professionals, psychiatrists or psychologists.
Thank you so much, sir. I think we have taken half an hour more than has scheduled. I know that the psychology or the manners is not a topic to be discussed with 1.5 hours. It's an extreme vast topic. And thank you to both Professor Raghunath and Dr. Bharati, because you wonderfully answered the question and helped our participants to manage their stress. Thank you so much. The main points which I learned from both of you is, take a risk. Risk is the main source of innovation. To better you take a risk, because you will anyways regret if you don't take it. So always take a risk, and that helps you to succeed in your life. The second is, Chandan, don't do the SWOT analysis of business, but first we'll do the SWOT analysis for ourselves. That is the second most important point. And thank you, Bharati ma'am, because you have explained wonderfully the stress management and the other aspects of it. Thank you so much. I would like to call Chandan for vote of thanks.
That was a wonderful session, and I would like to convey my message regarding this session, that I learned a lot from Bharati ma'am as well as Raghunath sir. That was a very informative session, and I would really like to thank you for providing valuable guidance regarding the psychological as well as the stress part. Thank you, Bharati ma'am, for your beautiful presentation. And we would like to have a few more sessions with you as soon as possible. Thank you, sir. Thank you, ma'am.
Definitely. Thank you, Lord.
Thank you so much. For the participants, we have provided the feedback link where you can get your e-certificate. Your feedback is very valuable to us. Please do give that. And thank you so much for both the professors. Thank you. Thank you, Krishna sir.
Dr. Devasri ma'am. We
Yes,
have taken this, me and Bharati ma'am have taken a risk in facing Dr. Devasri, Krishna Chandu. Finally, because of that, we have received the entire satisfaction. So that is more important. We got the entire satisfaction, happiness. Got the point?
Sir, we don't forget your hero concept, sir. We will be a hero.
Thank you.